Hello, Corpus Christians! I am Nurse Maite and I am your school nurse. How are you all doing? I hope you are all well and you are safe at home. You may be wondering why I am here today. Well, it's time for our health check. I do believe that students need to be healthy to be educated and educated to be healthy. So once in a while, I'm going to pop on your screens to give you advices on how to take care of your health. So for our very first topic, we are going to talk about... By now, we are aware that the outbreak of the disease started in Wuhan, China. Coronaviruses are a type of virus. There are many kinds of coronaviruses. Some of them can cause colds and more severe and life-threatening forms like SARS and MERS. The coronavirus is so small that you need a special microscope to see it. Corona means crown in Latin. It has antennas that stick out of it, just like the points on a crown. In order to live, they need to attach themselves to people. They travel into the nose, eyes, and mouth. The latest identified coronavirus, SARS-CoV-2, has caused a worldwide pandemic of respiratory illness, and this is called the COVID-19. So how does the coronavirus spread? According to the World Health Organization, the transmission of COVID-19 can occur through direct, indirect, or close contact with infected people, through infected secretions such as saliva, and respiratory secretions or their respiratory droplet, which are expelled when an infected person coughs, sneezes, talks, or sings. What are the symptoms of COVID-19? We have cough, fever, shortness of breath or difficulty of breathing, muscle or body aches, sore throat, loss of taste or smell, diarrhea, headache, fatigue, nausea or vomiting, congestion or runny nose. To know more about the day-to-day signs and symptoms of the coronavirus, let's watch this video.
Day-to-day symptoms of COVID-19. Before proceeding, please note that this general overview is compiled for initial self-assessment only and may vary for each individual. If you are not feeling well, you should immediately consult a medical practitioner to have an accurate diagnosis and proper treatment of COVID-19. The typical daily symptoms are concluded from the study of 138 patients at Zhongyang Hospital of Wuhan University, and another study involving 135 patients from Jinyintan Hospital and 56 patients from Wuhan Pulmonary Hospital. These symptoms are broken down into Day 1 to Day 2. The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. Patients can still consume food and drink as usual. Day 3. The patient's throat starts to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like mild nausea, vomiting, or mild diarrhea are possible to set in. Day 4. Throat pain becomes more serious. Other symptoms like feeling weak and joint pain start to manifest. The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius. Day 5 to 6. Mild fever starts. The patient show a temperature reading above 37.2 degrees Celsius. The second most common symptom, dry cough, also appears. Dyspnea or breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Other symptoms remain about the same. These 4 symptoms are among the top 5 key indications of COVID-19, according to the final report of the initial outbreak conducted by the Joint Mission of China and WHO. Day 7. The patients that haven't started recovering by day 7 get more serious coughs and breathing difficulty. Fever can get higher, up to 38 degrees Celsius. Patients may develop further headache and body pain, or worsening diarrhea if there's any. Many patients are admitted to hospital at this stage. Day 8 to 9. On the 8th day, the symptoms are likely to be worsened for the patient who has coexisting medical conditions. Severe shortness of breath becomes more frequent. Temperature reading goes well above 38 degrees. In one of the studies, day 9 is the average time when sepsis starts to affect 40% of patients. Day 10 to 11. Doctors are ordering imaging tests like chest X-ray to capture the severity of respiratory distress in patients. Patients are having loss of appetite and may be facing abdominal pain. The condition also needs immediate treatment in ICU. Day 12 to 14. For the survivors, the symptoms can be well managed at this point. Fever tends to get better and breathing difficulties may start to cease on day 13. But some patients may still be affected by mild cough even after hospital discharge. Day 15 to 16. Day 15 is the opposite condition for the rest of the minority patients. The fragile group must prepare for the possibility of acute cardiac injury or kidney injury. Day 17 to 19. COVID-19 fatality cases happen at around day 18. Before the time, vulnerable patients may develop a secondary infection caused by a new pathogen in the lower respiratory tract. The severe condition may then lead to blood coagulation and ischemia. Day 20 to 22. The surviving patients are recovered completely from the disease and are discharged from the hospital.
So how do we protect ourselves from COVID-19? First is to minimize physical contact and exposure. And that is by staying at home. That's right. And I don't think you really need to go to the mall to buy shirts, pants, shoes, dresses, because no one's gonna see it anyway, right? But if it's absolutely necessary for you to go out to buy your basic needs because your parents are unable to do so, make sure to always wear a mask and follow social distancing guidelines. And if soap and water are not available, you can use alcohol. Make sure to never touch your mouth, your eyes, and your nose. And when you go home, make sure to take a bath. Okay? So, for a second way to protect ourselves from COVID-19, make sure to boost your immune system.
According to Dr. Ronaldo Balburias, who focuses on functional medicine, we can boost our immune system by eating different colors of fruits and vegetables. Depending on the color, we can get vitamins that our body needs, such as vitamin A, B12, vitamin C, D, as well as zinc minerals to enhance our immunity. Vitamin A is important for normal vision, the immune system, and reproduction. Fruits and vegetables rich in vitamin A include sweet potatoes, kalabasa, broccoli, carrots, kale, and pechay. Vitamin D, also known as vitamin for life, helps regulate the amount of calcium and phosphate in the body. These nutrients are needed to keep bones, teeth, and muscles healthy. We can get vitamin D from sunbathing from 7 to 9 in the morning and can be found when we eat mushrooms and fish. Red fruits and vegetables are good as anti-inflammatory food. Orange veggies and fruits are antibacterial. Green ones are good for the blood vessels, like controlling high blood pressure. And purple ones are good not just for your immune system, but also to optimize your brain health. According also to Dr. Balburias, we must restore our gut health because 70% of our immune system is found in the gut. And to do that, we should eat lots of fiber from fruits and vegetables. We should also avoid eating processed food since these are riddled with chemicals and preservatives.
What else can we do to boost our immune system? We hydrate. We drink at least 8 glasses of water every day. What else? We get enough sleep. When we get enough sleep, it reduces the risk of us getting sick. And an average person, most of us, needs at least 7 to 8 hours of sleep.
What else can we do to boost our immune system? We can exercise regularly. Regular exercise is one of the pillars of healthy living. It improves cardiovascular health, lowers blood pressure, helps control body weight, and protects against a variety of diseases. Just like a healthy diet, exercise can contribute to general good health and therefore to a healthy immune system. It may contribute even more directly by promoting good circulation, which allows the cells and substances of the immune system to move through the body freely and do their job efficiently.
So before I end the session, I would just like to remind you to always wash your hands with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, or holding frequently touched objects like handrails and doorknobs. And if soap and water are not available, you can use alcohol-based sanitizers. Avoid touching your mouth, your eyes, and your nose. Avoid crowded areas. And if you can, stay at home. I hope you learned something today from our health check. And even if you are at home, you can still contribute in flattening the curve. And how do you do that? By taking care of yourself. Because when you take care of yourself, you're also taking care of others. Be mindful, in other words. This is Nurse Maite for Health Check at nagsasabing, ang batang maalaga sa katawan ay laging wagi sa hulihan. Stay safe, stay healthy, so we can continue to ride high as one.